Oh, let me flip it actually, because they can't see. Oh, actually, it's like this. There we go. There we go. All right.
I love the like smooth jazz.
It's nice, no? Today. I switch it up every day. All right, let's see.
You sound like Miami beats.
I know, usually I do play that for you. Hello, everyone. Welcome. We are here with the famous.
Don't get famous. Don't. I knew you were gonna do it.
We are here with the famous Dr. Hamamjin.
Yeah, you
How
just
are
like you
you?
to turn red. Well, thank you.
How are you today, doctor?
I'm great. How are you?
I'm good, thank you.
Perfect.
Guys, we have Dr. Hamamjin here, so please feel free to ask him any questions. Don't be shy. Now is the time to ask, okay? So please ask Dr. Hamamjin any plastic surgery related questions that you guys may have. He's having a great day today. He's in the mood, and we only have 10 minutes.
In the mood.
He's
I mean,
in
I
a
do
good
avoid the
mood.
camera. I
He
avoid
does. He doesn't point the camera. So guys, you guys are lucky to
No.
have him on camera
I'm
today
lucky.
here. So good morning, Lyndon. How are you? Do you have a question for Dr. Hamamjin? Please feel free to ask. I'm hoping that you're having a happy Friday. Thank you so much for following, Simone. Please also ask us something if you do. Now, one of the things that I always make little jokes about, for example, is the use of my filters on TikTok.
Okay.
I am wondering, when people are coming in to do their plastic surgery consultations with you, what do you think about when they do come in with these like filtered looks and images?
I think it's just important to be real with people. You know, I think filters are fun. I think that's like most things. I mean, things start as fun and then they kind of sometimes develop in other ways. I mean, even for myself, like I hate taking photos of myself. I hate walking by mirrors. So for me, I avoid it. But they should be fun. But I think sometimes now people are like seeing themselves as another person. And I think, especially like everyone always says, oh, since COVID, like people were doing more webinars and things, so people are more aware of what they look like. But it's cheesy to say, but like I think the personality for me is always like the key. I don't know. Like no one's perfect at the end of the day. God knows I'm not.
Agree.
And I think it's a really hard society for kids nowadays because there's so much pressure, like even just for this, for filters and stuff. I mean, everyone posts, or just Instagram, like everyone posts their best life and this and that, but like you never know behind the closed doors. And so I think it's just good to be honest with people. Patients are always, you know, receptive and you have that conversation. But yeah, I mean, I don't know, it's evolving.
I agree that like people mostly post their highlight reels on
Yeah.
social media. So when people come in and they have unrealistic expectations, how do you tend to manage that?
It's a conversation, and it's when you tread lightly. And I think for me, one of the things at work, I think, is just being honest about like my own insecurities. Not to say that, you know, patients being insecure or whatever, but I think when you can find a way to relate to them and just be real, people usually appreciate that, I've found. Especially in Miami. Like a lot of people will promise the world, and I think it's just important to be real and you know, I'd rather under promise and hopefully over deliver. That's my cheesy like one-liner, I guess. But no, I mean, I'm really lucky with the patients I see. I mean, they teach me, I teach them, and so it's a fun dynamic. Like I enjoy getting to know people, and I think that's part of what makes the job fun. I love what I do, but I think a component of that is like being able to relate to someone a little bit. It's almost like speed dating when you meet them, right? Because sometimes people come from out of town, you haven't met them, and so trying to establish that connection, that you're getting inside their head of what they're looking for. And sometimes the filters help with that too. I mean, it's an enhancement of something, but having that conversation of like, okay, I get what you're like, you want more hip, you want more or less waist. And so that, and even with like wish pics, that's the same idea. It's not to say like, oh, I can promise you this, because sometimes you just don't know how she might react or things like that. BBLs are an easy example. Sometimes you know, inject fat and it can disperse a little bit. Sometimes people have more structure, and sometimes you can predict some of that in advance. But I think just, I don't know, being honest with people.
I love the fact that you have the empathy with every patient. Now we have Simone Purawater. Good morning, as well as good morning, Paulette. She says she did her first surgery there in 2021. That's fantastic. Mr. Goodnight says good morning, Dr. Hamamjin. Sweetheart says she needs skin removal, basically a mommy makeover. And basically, if you'd like that, sweetheart, please go ahead and send your details down below in terms of anything cost and financing related. Here, we would love to discuss, for example, if you are interested in a mommy makeover, what does that entail for those who may not know?
So that's another, I have a lot of pet peeves. But I think there's a few reasons. I always make the joke of like, I try to be very body positive. So just because you are a mommy doesn't mean you need a makeover. I always say, like, if it's important to you, it's important to me. And I always make the joke of, like, there's a lot of dads that could use a mommy makeover, for instance. And it's true, right?
You should call it a poppy makeover.
Yeah. Macho makeover.
Oh,
that's
yeah,
a thing.
also.
So, and then also there's the confusion sometimes of what you're doing for the breast. But usually it's some combination of a tummy tuck, be it like a mini or a full, with some combination of a breast procedure, which is usually a lift or augmentation. And that's because with breastfeeding, things like that, sometimes one breast can get a little larger than the other, sometimes they drop, and so that's kind of how that came about. But it gets a little confusing, like even to understand, oh, I had a mommy makeover, okay, did you have a lift? Did you have just implants? And so I can always figure it out if they've had something prior and what they're looking for, but yeah.
How can you determine whether someone needs a lift versus when they need an actual implant?
So implants are more to add volume, right? With a lift, you're looking at the nipple position mostly, and so you look in relation, there's a few different ways, but the breast crease, so if the nipple's essentially pointing towards the ground, that's a clear-cut case where you need a lift. Sometimes with a lift, you still might want added volume, and so you combine the two. If someone's nipple essentially is in a good position, a lot of the time they don't need a lift. There's some caveats to that, things like pseudotosis and all that, but for the most part it's kind of looking at the nipple position, and like I said, there's a few caveats to that.
That's interesting.
Yeah.
Guys, things to learn. We're gonna definitely delve deeper into that in a video. I already have a video. So we have Moni who says, hola, Dr. Hamamjin. If you guys didn't know, Dr. Hamamjin actually speaks Spanish, so
No, you keep making me turn red. That's why I don't do these.
All right, so we have Andrea da Silva who says, what's your favorite procedure? And don't say none, because I know every parent has a favorite child and they lie when you ask. So
No, I love all procedures.
there we go.
I think, okay, so some of my favorites, I will say this is like a roundabout way of saying it. I think when patients have done the work prior, and look, not everyone, people do the work and sometimes they still don't get the result they're looking for, so I think it's not a clear-cut answer, but when people have done the work, they're fit, they're in shape, things like that, they always get a better result. It's just because, they have more muscle, they have more definition, and so, but there's ways of going about it, and so it's not really a favorite, but I do like, it's kind of like they got to the finish line at the end of a race, and you get to like help them with that, so that's always fulfilling.
The cherry on top.
Yeah, and I think, I like everything I do. If there wasn't something I liked, I wouldn't do it. Same thing goes like, if someone doesn't need something, I won't do it. Just because I think, you want to give someone results.
What's the easiest procedure, you think?
I've never thought about it.
What about chin lipo?
It's different. Chin lipo I wouldn't say is the easiest because there's a lot of structures there.
There's a lot of
I mean, I could say like a biopsy of a mole.
Oh, okay.
But
do you?
I try not to think about it. You can biopsy things,
Oh,
yeah.
okay.
I mean, I think part of me never thinks of something as being like the easiest, just because you want to treat every case
As if.
Okay, equally important. So I think that's why.
Okay. So let's say, what's the least time consuming?
Biopsy of a mole.
Guys, we don't do that here just in case. Okay?
It depends. Like, look, even for breast lift or breast reduction, if someone has smaller breast, it's going to be a lot quicker. If someone is a little bit heavier or fuller and you're doing lipo, sometimes it's quicker, sometimes it's actually slower. So it depends.
It depends on everybody is different.
Yeah.
All right. So Andrea says, what do you like the most about being a surgeon?
I like being able, it's cheesy, to help people. Hopefully. I hope to. I mean, at the end of the day. I always joke, like, I used to joke of, like, oh, saving one day at a time, or life at a time. Because look, in surgery, you always think that that's what the goal is. But I think adding quality of life to people's lives and helping them express who they are externally with who they feel internally, it's really fulfilling thing. I think for patients who, you know, there's all different situations when people have lost weight, when people unfortunately have had cancer and you're trying to help reconstruct things. If, you know, with gender affirmation surgery, I think that's a really nice one. And that was actually one of my first patients. She had told me, like, because I would joke, like, oh, you know, we don't save lives when we do. And she was like, no, you do, because you add, especially for that community, or at least her perception for herself, is you add value to their life. And especially for someone who, you know, may not, who identifies differently than how they're viewed externally, it does. And I think we can all relate to that on some level. I mean, there's different variations like anything, but I think that's nice.
I love that. That's a fantastic answer, actually. All right, guys. So we have one other questions that I see here. So Mr. Goodnight 114. Wait, I missed Lyndon. Lyndon says,
I've got to run to surgery when I finish.
all right, guys, he needs to go, but we just have one compliment from Lyndon to make you blush.
No.
So she says Dr. Hamamjan is very good looking, and then she put the eyes. Okay, all right, I agree. Now, Mr. Goodnight, I only look like this with Dr. Hamamjan on screen. Usually I look different. No. We only have one other question, which is there an age limit to where you would not perform a procedure?
It just depends. It's like the whole picture, right? So it goes back to the whole, you know, treating someone as a whole person, treating people like they're your own family or friends. You know, there are people that are in their 20s and on paper may not be as healthy as someone who's in their 40s, 50s, 60s even. I mean, I have a lot of patients who may have more years than another patient, but the recovery sometimes is like that. Women as a whole, I think, are tougher than men in terms of, like, they're like, this is nothing. Whereas the guys, and myself included, if I ever had something, would be like, oh my God, what is going on? Like, so it just depends. I mean, there's no like hard and fast no, but you have to be, I mean, the blanket answer is you have to be healthy on paper. And so we pre-op you, we check your labs, and you see your primary care and things like that. So you always want to optimize.
Fantastic. All right. Well, thank you so much, Dr. Hamamjan, for joining. Andrea wanted to know where we were located, which is Miami. So if you'd like to book a free consultation, you guys can feel free to leave your details in the little blue box down here. If not, you guys can always visit avanaplasticsurgery.com, which is in one of the links on our profile. But in the meantime, we are looking forward to seeing more of Dr. Hamamjan. So everyone, thank him. Tell him how cute he looks.
No. All right.